Hello, good afternoon, everybody. I would like to thank the organizers for giving the opportunity to bring our work on vaccine confidence to your attention. I'm Hendrickx. I'm the team lead of the ConfiVax team that is located in the Vaccinopolis at the University of Antwerp in Belgium. ConfiVax team is a team that is dedicated to vaccine confidence, vaccine communication, and education. In this team, also the European hub of the Vaccine Confidence Project, led by Heidi Larsen from the London School of Hygiene and Tropical Medicine, is embedded. In wake of the COVID-19 pandemic, with more people in the world thinking about vaccines than perhaps at any time in our history, the term vaccine hesitancy was already gaining traction in vaccines discussion in the decade before COVID-19 erupted. In the 18th century, when Jenner started to inoculate the cowpox, vaccine hesitancy cartoons already appeared, where you could see that people were changing in animals or getting animal faces. So nothing really changed in comparison with the COVID-19. In 2012 already, WHO, after a SAGE meeting, disseminated the definition of vaccine hesitancy. Vaccine hesitancy refers, following the WHO definition, to a delay in acceptance or refusal of vaccination despite the availability of the vaccine or the vaccination service. Vaccine hesitancy is complex and context specific, varying across time, place, and the vaccine type itself. But vaccine hesitancy is influenced by different factors, but makes that it's not very static, but that it can change over time and that it has a dynamic nature. The WHO definition of vaccine hesitancy, you could say that all the people that refuse or delay the vaccines are vaccine hesitant. But that this definition is too narrow, because you have people that accept all vaccines, or you have people that refuse all vaccine, but in between you have the vaccine hesitancy continuum, because people that are accepting, they also can have questions, they also can have doubt. People that are refusing, first maybe they also have questions before taking their decision. So vaccine hesitancy can be defined as a continuum. Especially to mention is also that when anti-vaxxers are the people who refuse all, anti-vaxxers are often a very small part of the population, but they make a lot of noise, and they had the ideal platform by social media to really disseminate their message worldwide, but gives them a platform that goes very fast. Already in 2019, vaccine hesitancy was put forward as one of the 10 threats to global health by WHO, and got already a lot of attention in that period. In the same WHO SAGE meeting in 2014, the determinants of vaccine hesitancy were listed and classified in three major groups: vaccine or vaccination specific issues, individual issues or social issues, and last but not least, contextual influences. One of the example for such a contextual influence are politics, and for this example, influencers was shown by a graph that appeared in the New York Times, where they plotted the different states in the US ranked according the Biden and Trump votes. So the red ones are the Trump voters, and the blue one the Biden voters. On the y-axis, you can see the vaccine hesitancy, or the uptake of the vaccine boosters, where you clearly see a relation between the voting for one of the both of the candidates and the hesitancy or the uptake. So politics really can also be seen in vaccine hesitancy. Measuring vaccine confidence is a very important issue to follow the trends and to see if there becomes problems in the uptake of vaccine. The Vaccine Confidence Project already is measuring vaccine confidence already since 2015. The Vaccine Confidence Team measured in more than 60 countries all over the world the importance, the safety, and the effectiveness of vaccines. And it strikes them that in Europe was the region with the lowest vaccine confidence, especially in France. Therefore, after fine-tuning the questionnaire and the methodology, and with the support of the European Commission, they ran three consecutive surveys within 2 years in between in all European countries in 2018, 2020, and 2022. The questions were asked if the vaccines were important, safe, effective, and if they were compatible with their beliefs for overall the vaccines for MMR, HPV, seasonal influenza, and COVID. This is the results of this vaccine confidence measurements. It's a little bit a crowded slide, but I will guide you through. The results of 2018, 2020, and 2022 are shown for all European countries. The vaccine importance is mentioned in pink, in green, the safety, the effectiveness in blue, and the compatibility with the belief of the respondent is in purple. So what you can see is that we see for most of the countries a declining trend, so that the results of 2022 end up lower than 2020, but it has to be noted that for the measurement of 2020, at that time, the COVID vaccines were announced, but not yet available in most countries, which probably create a higher confidence than normally would expected. But the question stays, if this decline in comparison from 2020 to 2022, is this really a fluctuation, or is this the outcome of the COVID pandemic, and will we go up later on? Also, an important result to mention is that when we analyze the social demographics, we see that the age gap in confidence is widening between the younger group from 18 to 30 years old and the older age group above 60. The most striking results when we are looking for each disease are the ones for HPV, where we see in almost all countries a decline in confidence in comparison with 2020. Also, the confidence in healthcare professional was measured. Also, the confidence in healthcare professionals was surveyed in a total of 3,000 healthcare workers, GPs as well as nurses. We asked them the same questions on effectiveness, importance, safety, and compatibility with their belief. If you compare the vaccine confidence index, that's the sum up of the four questions on importance, safety, effectiveness, and compatibility, the confidence of the healthcare providers end up much higher than in the general population. Also, for most countries, the healthcare providers' vaccine confidence appears to be high and stable over time. In the majority of the countries, there are signs of decrease of vaccine confidence in a few countries like Austria, France, Greece, and Slovakia. When comparing the likelihood of recommending vaccines by healthcare provider in most countries, more than 90% of the healthcare provider would recommend the different vaccines. But important to note is that there are nonetheless countries where less than 90% would recommend vaccines also for measles, but even more for HPV. But why are we measuring this vaccine confidence in the healthcare providers? It seems that not only for medical information, but in general, the healthcare providers are seen as the most trusted source for information. But also this can be different in different regions. If you focus on the European region in this outcome of the Welcome Global Monitoring, you see that especially in Eastern Europe, they have less confidence, the general population has less confidence in the healthcare provider than in the other European regions. But what with the trust in the information about vaccines? The European Commission is on a regular basis performing European barometer studies where they survey the trust in different things, but also sometimes they include questions on their most trustful information source. For the general vaccines, that was done in 2019, and in 2022 they asked for the information on COVID. For almost all countries, the most trusted source for information was the healthcare provider, except in the Nordic countries, in Finland, Sweden, and Denmark, where the general population trusted more the information of the authorities. Also, very recently in the Elderman Trust Barometer, again, the role of the healthcare provider as most trusted source for information on health was emphasized. But although healthcare providers play an important role as trustful source for information, they can be vaccine hesitant themselves. The last 10 years, more than 800 publications appeared on vaccine hesitancy in healthcare providers. In this example from Italy, they are describing the reasons why healthcare providers are hesitant, and they indicated that a lack of receiving information and receiving conflicting information gives that they lack in trust of vaccine safety. So we asked ourselves how confident are healthcare providers to answer questions of patients about vaccines. Therefore, we developed the Vaccine Training Barometer. It's an online survey that counts around 12 questions to measure the confidence of healthcare providers to answer questions about vaccines, to measure their need for extra training, and we also try to estimate if enough time was spent in their education. This vaccines training barometer was tested from November 2020 to January 21 in Flanders and in Spain, and later on in June 21 it was also an adapted version was tested by the Coalition for Vaccination, which is a European assembly of organizations representing in-service and pre-service healthcare providers. The results were rather astonishing and are recently published in Vaccines. We found that 1 on 3 healthcare provider feels confident to answer questions about vaccines. It means that 2 on 3 doesn't feel confident to answer this question. What is astonishing, as you know, that almost 1 on 2 receives the last 3 months questions they could not answer. If we try to estimate the gained knowledge during their standard education, only 10% of these surveyed healthcare providers said that there was enough information in their standard education. But luckily, they are willing to follow extra courses. In the vaccine training parameter, a high proportion of the healthcare providers indicated that they didn't gain sufficient knowledge in their standard education. To investigate if this was true, we also surveyed the students to investigate the student knowledge, the attitude, and the confidence and the attention given to vaccination in their current curriculum. Thanks to the different student organizations involved in the Coalition for Vaccination, a high response rate of more than 3,500 students was achieved. 57% of these students feels that not enough attention has been paid on vaccinology. And for 1 of 5 students, no or only very little information about vaccines was or is educated, and for the most students, it was spread over different courses. Since these students are future healthcare providers, we investigated if they would recommend vaccines to their patients once they are in practice. In general, they don't feel confident to recommend vaccines, certainly influenza and COVID, and even 1 or 3 students would not recommend the well-established and very important MMR vaccine, not to mention the influenza in pregnant women. These students were also particularly missing practical skills and especially communication techniques. And to gain more confidence, they asked a more extended and dedicated module on vaccination in their curriculum, and in general also access to trustful information sources, including that includes vaccine recommendation and more details on vaccination schemes. Adaptation of the medical and paramedical curricula is really recommended. But not only the students, as also the in-service healthcare providers, including GPs, nurses, midwives, and pharmacists, indicated in the vaccine training barometers that they are willing to follow training. Communication training would really be appreciated by them. Several communication trainings are already available online and worthwhile to mention and to have a look at, like the one of ECDC, the WHO communication with patients about COVID vaccination, and the one of CDC talking to parents about vaccines. We really could recommend as well for healthcare providers as for students. As we are convinced that communicating about the benefit of vaccination can really influence the confidence of the population and especially of parents of your patients, we gathered a few tips for communication with your patients. As an healthcare provider, you always have to assume that the parents or the patient want the vaccine. Do not start with a question or a doubt, but propose them to get vaccinated. Be respectful, listen to their fears, their concerns, or try to understand them. Do not ignore or judge them. So use the techniques that are used in motivational interviewing. Always be very transparent and tell the truth. You are the most trusted source. So as a healthcare provider, don't underestimate your influence. Use scientific facts, but also personal stories. Often it's good that they know that you as a healthcare provider vaccinate your children. Doesn't correct myths, doesn't emphasize the myths, because if you always reinforce those myths, they always will repeat and they will exist. Use positive rather than negative framing. So we often speak about vaccine hesitancy, but we prefer to speak about vaccine confidence. Adapt your language and use inclusive terms. Speak as we as a parent or speak as a member of their community. These are only a few tips. More tips and tricks can be found in the trainings that I already proposed before the tips. The take-home message for these presentations are that vaccine confidence is multifactorial and that can be influenced by a lot of factors. We see in the general population as well as in the healthcare providers a declining in confidence, but we are not sure if it's really a trend or if it's more a fluctuation. Most trustful source are the healthcare providers, but they are sometimes lacking of confidence themselves. More research need to be done to understand the specific barriers to accept vaccination, and tailor-made training for in-service as well as for pre-service healthcare providers are needed, and an adaptation of the curriculum of the medical and paramedical students is a must to improve the vaccine confidence also in the general population and in the healthcare providers. Besides my team, I would also like to thank you for your attention. If you have questions, don't hesitate to ask them. Thanks again for your attention.